Welcome to the AcqNotes tutorial. In this tutorial, I'll be giving a brief overview of the Department of Defense Joint Capabilities Integration and Development System process, or JCIDS for short. This tutorial will cover the basics of the JCIDS process, its objective, and its major steps. The DoD procurement process is made up of three individual processes. These individual processes are the acquisition process, the program planning, budget, and execution process, or commonly called the PP&B process, and the JCIDS process. The acquisition process is focused on the management and execution of all DoD programs. The PP&B process is focused on the financial management and resource allocation for current and future DoD programs. It's basically the funding process for any acquisition program in the DoD. The JCIDS process is focused on identifying capabilities that are required by the DoD to carry out its mission. It's focused on determining the needs of the military and developing requirements to satisfy those needs. Requirements that will be executed by the acquisition process. Each of these three processes make up the DoD procurement process. However, they are not standalone processes but integrated as together. Each process is vital to the successful execution of the other process and any DoD program. The JCIDS process is governed by two documents. These two documents are Chairman of the Joint Chiefs of Staff Instruction 3170.01 and the JCIDS Manual for the Operations of the JCIDS process. These documents will be explained later. The primary objective of the JCIDS process is to ensure the capabilities that are required by the Joint Warfighter are identified. Along with identifying these capabilities, the associated operational performance criteria to successfully execute a mission are also identified. These main operational performance criteria are called Key Performance Parameters and Key System Attributes. The JCIDS process also makes sure the key capabilities identified in the National Defense Strategy, National Military Strategy, and National Strategy for Homeland Defense are addressed too. The JCIDS process supports the acquisition process by providing operational requirements documents. The three main requirements documents it provides are the Initial Capabilities Document, or ICD, Capability Development Document, or CDD, and the Capability Production Document, CPD. In these documents, the main operational performance criteria are identified. These documents provide the foundation for every DoD program. The top figure is the most commonly graphical layout used by the DoD to depict the acquisition process. This slide shows the phases, milestones, and reviews of the acquisition process combined with the major products or documents of the JCIDS process. The process starts on the left and works its way through a series of phases until it reaches the end on the right. The JCIDS process has four main steps. The first step is to conduct a capabilities-based assessment, or commonly called a CBA. The CBA is the analysis phase of the process and validates capability gaps. These capability gaps are what the DoD needs to execute its mission. Results of the CBA is to develop an Initial Capabilities Document, ICD, or develop a non-material solution to satisfy a capability gap that has been identified. The second step in the process is to approve an Initial Capabilities Document and courses of action. The Initial Capabilities Document is the top-level requirements document for any program. The courses of action they can take by the DoD include accept operational risk and take no further action, seek a non-material approach to address the capabilities gap as an alternative to a new material solution, or recommend a new material solution. If a material solution is recommended, the process goes to step 3. Step 3 of the JCIDS process is the approval of the Capability Development Document, or CDD. The CDD is the main operational level requirements document for a DoD program. The CDD is approved by the Joint Requirements Oversight Council. In approving the CDD, the JROC validates the key performance parameters, or called KPPs, and their associated threshold and objective values. They assess the risk in meeting those capabilities in terms of cost, schedule, and technology maturity, and assesses the affordability of the system as compared to the operational capabilities being delivered. The final step in the JCIDS process is the approval of the Capability Production Document, or CPD, by the JROC. The CPD captures the information necessary to support the production, testing, and deployment of a system. The JROC's objective in approving the CPD is to ensure that the system being delivered meets the needs originally defined in the ICD and affordable cost. If the system does not meet all the threshold levels for the KPPs, the JROC will assess whether or not the system remains operationally acceptable. The approved CPD informs the Milestone Decision Authority, the MDA, to enter the production and deployment phase of its system at Milestone C from a requirements perspective. The JCIDS process is governed by two documents. These documents are Chairman and Joint Chiefs of Staff Instruction 3170 and the JCIDS Manual for the Operation of the JCIDS. The purpose of the Chairman and Joint Chiefs of Staff Instruction 3170 is to establish the policies and procedures for the JCIDS process. The JCIDS Manual for the Operation of the JCIDS tells you how to execute the JCIDS process. Both of these documents are critical for DoD and program personnel in understanding the JCIDS process. Well, that concludes this brief tutorial on the JCIDS process. I hope you found it informative and worth your time. For more information, please visit AcqNotes.com. Thank you and have a nice day.